Welcome to the Q&A, guys. Steve Williams here at Tri-Valley Plastic Surgery. I'm a board-certified plastic surgeon in Northern California, and we are answering your questions. Let's get to it. Yes, and so the nice thing about fat transfer is once you've healed, and if you have enough fat somewhere else, you can do revisions or additional procedures to add additional volume. Now, the first procedure is usually the most effective, but you can have a secondary fat grafting to get a little bit more volume. Plastic surgeons were always thinking about safety, and if you look at overall safety in terms of horrible, bad events like death, tummy tuck is actually one of the more dangerous operations. Now, that's not to say that everyone should be afraid of getting a tummy tuck. It just means that when we look at the entire regimen of all the surgeries we do, abdominoplasty is a little bit more risky compared to the other ones. And the reason why is because of blood clots. As we're really pulling those abdominal wall muscles together, sometimes people can get blood clots in their legs, and those can break off and travel to the lungs and cause pulmonary embolism. And that is the major morbidity from abdominoplasty in terms of really real risks. Now, the great news is plastic surgeons are super focused on this and making sure it's safe. And we do literally, I've done thousands and thousands of tummy tucks, and people have done very, very well. But it means that we have certain things that we do. We have special boots on your legs that reduce the chance of you getting blood clots. We encourage early ambulation. We're doing things to minimize pain, so you're getting up and moving around right after surgery, so we really reduce the risks of that. And so if you have to choose one operation, that's probably the riskiest, but it's still very, very safe. So this is a great question. I get this question all the time. The answer is, it depends, and there isn't a ticking clock in your chest that is going to expire after a certain amount of time. When people are on the internet, they always come to us and say, I've heard you have to change your implants out every 10 years. And I kind of say, well, number one, that number probably isn't the real number anymore, because that number was based on historical ways and old implants and the ways we used to perform the surgery. Implants have gotten better. As surgeons, we've gotten better, our techniques are better. And so that number now is probably closer to 13 years. But the important thing to remember is 10 years, 13 years, those numbers are averages. And what that means is, on average, for any reason, people have their implants replaced about every 13 years. It could be, I wanted to go bigger. It could be, I wanted to go smaller. I didn't like them. I just wanted them out altogether. It could be, I had some scar tissue. For any reason, about every 13 years. And because it's an average, it's impossible for us as surgeons to know, are you the 3 or 4 year person, or are you the never person? We definitely have patients who come to our office who say, I've had my breast implants for over 20 years. Do I need to have them changed? And the first question we should ask is, how are you doing with them? Are you happy with them? Do they feel normal? Have there been any changes? When my patients say, I love them, I say, there's no reason that you have to change them then. So remember that on average, about 13 years. Thanks again for all the questions. Again, you can see we really try to get to answer every single question that's asked. It's really an honor and opportunity for us to be able to interact with you this way. So keep them coming, and we'll see you next time. Thank you.